Ursula, so now that we've done some nerve glides and therapeutic exercises, what I'm gonna have you do is gonna demonstrate some of your daily activities to see if I need to make any activity modifications to help alleviate some of your symptoms.
Okay.
So you mentioned in your previous eval that you've been having some difficulty with your shoelaces, your bra, zippers, buttons, and socks.
Yeah.
So what I'm gonna have you do during the session is put on your socks. So take off your sock, put it on.
Okay.
Do you put on your shoe and then tie the shoelaces and then do the zipper on your jacket. So
Okay.
go ahead.
All
Why don't
right.
you just show me how you do those? Tiffany.
All right. So, I'm gonna go like this. Just kind of bring it up and over.
Perfect.
Tighten it up. All right.
Good. Now, how do you usually tie your shoes?
Pull my sleeves up.
You only have to show me one for this exercise.
Okay. All right. Yank it up like that. Just kind of relax it like that.
Okay. Nice. So now I'm gonna have you put on your jacket and do the zipper so I can see how that's going for you.
Then zip it up.
Okay. Nice work. Now you sit back down and we'll go over those tasks. So overall good job. Seems like your pinch and grasp have been a little better lately. Still struggling a little bit with that.
A little bit of pain when I do it.
Okay, and then so what I want you to do while you're doing all your daily tasks, I want you to really practice maintaining that neutral wrist position. So avoiding any excessive positions that put pressure or stress on that median nerve in that carpal tunnel region.
Okay.
So that means no excessive flexion. So when you're gripping your shoes or your socks, to not grip it too forcefully or pinch it too forcefully.
Okay.
Just because that can put some extra pressure on that median nerve.
Okay.
And then what I also, modification you could do for your shoes, so you don't have to continuously and repetitively do the shoelaces because we want to avoid repetitious movements with the wrist, is keep it tied and use a shoelace or a shoehorn.
Oh, okay.
So that can help as well. And then, with the zipper, I think zippers are good so you're not avoiding that repetition with buttons. So trying to use more clothing with zippers over buttons. So, and then avoid keeping that wrist in that neutral position still.
Okay.
So, and to help do that too, what I'm going to suggest for your left wrist, because that wrist has been having a little difficulty just in those early stages of carpal tunnel, that you've been having some numbness and tingling, I'm going to recommend this neutral wrist position splint. So you can use that during your daily activities for now. I know that it wasn't very helpful while you were at work at the salon, but for now it can be very helpful to use it as much as possible during the day and then at night too, to avoid excessive bending.
Oh, okay, yeah, like while I'm sleeping I can just leave it on and, okay.
Yep, exactly. So that's another recommendation I have for you. And then I see that you've been having some swelling.
Yeah, it's pretty swollen right now.
Yep, and inflammation in your right wrist from that surgery, and a little bit of pain. So I recommend that you do use an ice pack on that to help kind of alleviate the swelling there and the inflammation. So do that 15 minutes on, 15 minutes off for that right wrist.
Okay.
That sounds good. So and then once you continue to do these activity modifications, we'll transition that hopefully to your work environment once you're prepared to go back to work at the salon.
Okay. Yeah, that sounds good.
Awesome.
Thank you.
Nice work.